We'll be covering thoracic outlet syndrome. So to get this movie started, we're going to start talking about what the thoracic outlet is. So the thoracic outlet is actually just a space. So remember, we're going to have our heart down here, and on each side, our right and our left side, we're going to have our subclavian artery. So on the right side, we're going to have our brachiocephalic trunk, which will come up and branch into our carotid and then our subclavian. On the left side, it's going to be right off the aortic arch, and it's going to just become the subclavian as soon as it's a branch off of the aorta. So the subclavian artery is going to come, and it's going to divide in the space between the scalene muscles, right where the brachial plexus comes out on both the right and the left side. So we call this the thoracic space, and hence we're going to call it the thoracic outlet syndrome. So the thoracic outlet is just a space between these anterior and middle scalenes. And you can see the subclavian artery is going to travel between those anterior and middle scalenes along with the brachial plexus. And what happens is sometimes you can imagine instances where this space, this triangular space right here, will narrow, causing constriction on the subclavian artery and or the brachial plexus. That is the idea that is going to lead to thoracic outlet syndrome. So a narrowing of this space causes nerve and vessel impingement. So we'll look at a couple things associated with that. So this is just getting a little bit more at what I was just kind of talking about. What is it? Thoracic outlet syndrome results from compression of the nerves in the brachial plexus artery and or vein. So the thing I want you to glean from a couple of these pictures here is sometimes thoracic outlet syndrome only occurs in specific movements or positions. So it's not something that is always omnipresent if a person has thoracic outlet syndrome. Sometimes you have to position the person just correctly where it actually narrows that space and causes constriction, thereby leading to thoracic outlet syndrome. So sometimes it's when the arm is raised up. Sometimes the arm has to be raised totally up. So a few symptoms of this thoracic outlet syndrome: neck, shoulder, arm, and hand pain, poor circulation. This one's going to be a common one, especially if that subclavian artery is being constricted at all. This weakness and numbness in the arm and hand, that's going to be more from the nerves. And then this slide also shows a couple spaces of the possible narrowing. Obviously, we mentioned those scalenes in that triangle. You could have a rib, which is causing some problems. The costoclavicular space, right? It could be some muscular constriction where these pecs come up. So there's lots of potential chances for that narrowing to occur, all right here in this small region. We're going to skip these because I think we kind of already talked about those. So these are a few more of these causes of narrowing. So obviously the muscles, right? We in that previous slide, so if I come back up, this pec minor as it comes up to the coracoid process of the scapula, that can be a place of narrowing. So muscles, right? The scalenes could be a problem. The pecs could be a problem. You could have your subclavian muscle. Anytime someone experiences unusual hypertrophy of these muscles, for example, swimmers oftentimes will have enlarged scalenes just because of the motions that they constantly go through. You could also have some overhead athletes, maybe some volleyball players, maybe even in occupations, right, outside of athletes, people that are overhead a lot of the time, electricians, construction workers in general, drywall people, linemen. So there's lots of instances where these muscles can hypertrophy because of overuse in different professions or athletics or other things. You could be constricted right here at the clavicle. You might have a problem at the first rib. Another thing that I wanted to mention, in a small percentage of people, there's actually a false rib, and it's a cervical rib above the first rib. Sometimes you'll have a cervical rib that can come up and constrict this subclavian artery and the brachial plexus. Poor posture. If you take a second and you play around with your posture, you can imagine how you can constrict this area by using a forward head, rounded shoulders posture. Tense your traps up as you kind of sit there, and you'll feel some constriction. And then obviously anytime if you have like a cyst or a tumor or whatever in this region, you can obviously constrict that space further. This is a little bit more about the arteries and the nerves and the veins. Hopefully you're beginning to understand how those things can be constricted. I'm going to keep going down a little bit. So diagnostic tests. So how do we actually test this? So there's ways that you can test the velocity of a nerve. Uh, you can test the muscles using this electromyography. So an arteriogram is going to give you an idea of the blood flow through the artery and a venogram through the vein, checking for constrictions. You can look for that cervical rib or other things. So there's some ways that they can actually go through and objectively identify thoracic outlet syndrome. This is one of those arteriograms or a venogram. I'm not sure which one it is, but this is essentially looking at the blood flow. So let's move down a little bit into treatment. Okay, let's move down a little bit into treatment, and then we'll talk about some other diagnostic tests we can use in class to check for thoracic outlet syndrome. So thoracic outlet syndrome, because of its causes, a lot of times, if it is due to musculature, those are things that we can obviously treat conservatively or non-surgical, right? We can retrain posture. We can allow muscles to calm down. If they are hypertrophied, we can have people rest, and those muscles will come down. So there's lots of ways, stretching and other things that we can use to get those muscles to not be so constrictive. If it's something like a rib problem, or it's more of a structural problem that's causing the thoracic outlet syndrome, obviously those things are not going to be fixed as easily using exercise. It may be improved with exercise, but probably not curable. So there's some surgical options where they can go in and cut some ribs, or they can enlarge the space of the scalenes. They can remove calluses or tumors. So there's some ways that they can go in and surgically treat that thoracic outlet syndrome if someone is having persistent problems often enough that's really affecting their lives. So I wanted to come down here. So diagnosis of thoracic outlet syndrome. This is that nerve conduction velocity test. So I personally have never done this. Dr. Johnson said he's done it, and he said that Dr. Phelan has actually done this a fair amount. So they have a machine that they can actually set up that's going to send an impulse down, and then this receiver is going to time. It's going to time the speed of the nerve transmission. So nerves travel very fast, so it's like 0.01 milliseconds. If you have a nerve that if you send an impulse and it's taking longer than that, then obviously that's one way to assess if you're having some type of a nerve problem using that nerve conduction velocity test. Clinically, we also have a few just easy, simple tests, and we'll do these in the lab. This one's called the Ruse test. So what you're going to do, again, it's position sensitive. So you're going to have the person abduct those arms, and you're just going to have them sit there, open and close their hands. If they can do that for 3 minutes, then they would pass this test. That would be a negative test for thoracic outlet. If after 3 minutes they're struggling to get their hands open, then that will be a positive test for thoracic outlet, and they're having some problems. So this one is more neurologically related. It could be blood flow related as well. If the person starts talking about, their hands are falling asleep, maybe you notice they're not getting sufficient blood flow to their hands. So this one could go both ways. This Allen test, you're actually going to palpate here at the wrist. Again, position dependent, abduct the arm, and then you're going to turn the head away. And you're going to be palpating the pulse. And what you're actually looking for is to see if that radial pulse remains strong, consistent, and steady. If you feel that pulse start to weaken, to slow down, or to lessen, then that would be a positive test on the Allen's test. Another one, position-dependent costoclavicular maneuver, same thing. You're palpating that radial pulse. You're creating a scenario that thoracic outlet might become impinged, and you're feeling that pulse to see if it maintains consistency or if it goes away or weakens or lessens. So there's a couple ones. There's a few more in the lab that we'll describe. They're very similar to these other two. They're position dependent. Adson's, Wright's test. So there's multiple instances of ways we can help diagnose this thoracic outlet by using these different tests. So some more treatment. So these are a few of the stretches that you might use in treatment of thoracic outlet. You can see we're just trying to create space in that thoracic outlet in between those scalenes at the place of the rib or at the pecs, any one of those. We'll keep going down. A few more stretches here that you can see and some exercises that you might also utilize as well. And that finishes up this video on thoracic outlet syndrome.